Welcome to the FeelWell Podcast, where leadership is lived through the integration of mind, body, and business. I'm your host, Dr. DeCicco, and today I'm joined by Catherine Okubo, CEO of MPB Health, and a leader who is bringing a really fresh and human-centered perspective to the future of healthcare. Catherine is a Brazilian-Japanese entrepreneur with over 2 decades of experience across multiple industries. From health and vitamins to legal, media, and international business, she's also the youngest and first female CEO of MPB Health, where she's helping to reshape access to care through innovative health sharing models. What stands out about Catherine is her ability to blend strong business strategy with a deep understanding of human behavior. How her personal and professional challenges have shaped the way she leads today. I'm really looking forward to this conversation, especially as we explore what healthcare, leadership, and true well-being can look like moving forward. Welcome.
Thank you for having me.
Yeah, we're really excited to have you. So you've had a really diverse path between all of these different backgrounds and industries, and now you're leading a healthcare company. So what in all of this kind of connects this for you and has led you to this?
Yeah, so I have started working at a very young age, 13 years old, at a family business in Brazil, which was actually vitamins and supplements. So my whole life I was very connected to health and wellness in that sense. But everything, when you're leading a business, you need all those skills in particular, especially if you are, managing other people. You have to deal with the legal, the accounting, the sales, the marketing, and you need to have some acting skills sometimes, it's a business, it's different. And basically all those experiences, even the psychology side and neuroscience, you have to apply on a day-to-day. And healthcare today is just everything is connected because you need to have the mental part of it, the physical part, right? And everything has to be balanced. That's why it's MPB Health. Mental physical balance.
Right. And were there some defining moments that shaped your decision to become a CEO or guide your path into this direction?
Yeah, so since I started working so young, in my mind I grew up thinking that I was going to be the CEO of the family business. I never expected to just be at a complete different company, right? But life has had so many different situations that pushed me that way. I didn't plan to do it, but basically, I had this long career and there were so many things that happened and I'm just trying to summarize it. But there was a point in my life that I basically lost everything. And I think everybody kind of goes through that when you lose your foundation, you lose your family, you lose your money. And after that, I had to rebuild myself from the zero, right? Because it's different when you're working at a family where you are like the daughter of the owner of the business, right?
You almost have a security blanket.
Yeah, it's like, okay, of course she's in a high position, right? But then when you lose all that, you have to figure things out on your own. So when I lost everything, I had to figure out, okay, well, I have to have something different going on. So I went in, had to go back in the workspace at an entry-level type of job when I was a new mom as well. And during that, I was like, okay, I'm going to have to have a different type of goal. I was thinking I was going to be a paralegal and that was going to be my career. But at the background, I always wanted to go back and manage a business because that's where my talents are. I like to do a lot of diverse things at once. And then I finally got the opportunity to meet the owner and founder of MPB Health by complete coincidence. And when I met with him, he said, well, I really want to hire you to be like my wellness spokesperson. And when I started working with him, I didn't expect to become CEO. He had a CEO in place at the time. And he started to realize that I had the business skills because of my background. And I started to help him with that because there were some issues at the time. And we created a business plan with other of his employees, and the CEO was gone. the business plan worked out and we reached all of our goals within a year. And then he made me the CEO. So I became CEO at a company that I didn't expect to, because it wasn't my father's business, basically, that I was used to for all my life. And then because I had the background in acting and modeling, I was also able to use that in his business in the health and wellness side, because we created a TV show for Brazilians in the US to explain them about healthcare in the United States, because it's very confusing, right? And that's how it all connects. Like all those skills that I didn't use for 15 years ended up being used again. And coincidentally, just everything kind of fell into its right place, the right people at the right moments too.
Yeah, and did you go to business school? Where did you collect most of your business experiences from? Your family business?
Yes, I didn't go to any college. I just went to acting school, acting academy in Los Angeles. But we started working at 13. Basically, I would shadow my father at his business. So every business meeting he had, every call, I was just listening to it and observing. And he would allow me to go from every department. So one day I could work in accounting, then the next day in legal, the next day in marketing, the next day business development, and just hang out and talk to his employees. And they taught me a lot, because at the time there was no AI, right? So you had to do everything like in spreadsheets. You had to use all these editing tools.
Right, they didn't have the software like they do now.
No, so we did a lot of marketing, print advertising was big there too. And then, as a 13-year-old girl, like there's not much that I could add value to, but I was big in social media. So I created the social media accounts like YouTube and Facebook, and that his business was one of the first companies in South America to have those accounts at the time. We did the whole brand ambassador and influencer situation that was brand new too. So, I just kind of tried to help as much as I could for a 13-year-old and learn everything through just real life experience. And I read a lot of books.
Yeah, I think that's what makes a really good leader, is somebody who's actually worn the shoes of everybody, all the different jobs in the company, of what each person does. But, as a leader, we expect people to do things, but we don't always do that ourselves or even know how to. And I think employees or companies or like the group of people have a lot more engagement and respect for their work when the leader themselves really understands it.
Yeah,
too.
Absolutely.
And I know in your company, I came across you through social media. So you guys are doing a lot of social media, the podcast and things like that. And honestly, that's how I've grown my entire business too. It's such an awesome untapped market, but it also makes you real to the community as well. So you guys, this company is a health share company, and it's really reshaping access to healthcare. What do you think is not working in the current system?
Well, for me personally, coming from another country, I used to think that healthcare in the United States was just health insurance, that was the only option out there. So when I found out about MPB Health, I didn't understand it. I was kind of shocked. I was like, wait, what is this? How does this work? But it is such a clear difference between health insurance and the health sharing model, because health insurance, in my opinion, it's basically like if you're participating in health insurance, and some people, by the way, for some people it's the right choice, but if you're healthy, overall, like you're basically going to be feeding a system that is profiting other people's sickness, because you can just tell by like a medication that costs maybe $5 to make, they will retail that for thousands of dollars. Health insurance system is basically trying to make people stay in care for as long as possible, because that's how they're profiting. They want you to be sick for as long as you can, but not sick enough to die, because you continue to pay the premiums, you continue to feed that system, right? So the incentive is not to heal,
right?
The incentive is to keep you sick.
Right. Like I'm generally healthy, so I personally have no incentive to have general health insurance because it costs me more per month than what I am ever going to use in a year. Now, if something catastrophic happened, yeah, that would make sense to have something just in case. But in general, regular traditional healthcare, I'm going to just pay out of pocket to go do my checkups and things like that. That's going to save me so much money. And even as a practitioner, I don't participate in taking health insurance because I actually think the most value comes when there's direct payment between me providing the service and them paying me. Like the intention behind it is much clearer. The road to getting you better is faster because I'm not going to try to utilize all of your insurance as a provider, which you see that a lot in medical practice and traditional medicine. And yeah, like you said, like I feel like even from a medical side, not just insurance, we're really a system that's trying to keep people sick or in the system essentially. So there's the focus isn't, preventative or getting people better.
Yeah, and that's why, like you just mentioned, basically you mentioned the cash pay system, which is the patient comes without the insurance. And that's how the health sharing model works. So at MPB Health, we offer what we call memberships, and they are based on the health sharing model. And the biggest difference is that in a health sharing model, you're part of a community. So you are incentivized to heal as fast as possible. Nobody in the community or the companies involved wants you to be sick because the less sick that you are, the less you're using the funds, the financial funds of the community. But that also means that you need to have a certain level of responsibility. Like if you are a person that likes to drink a lot, do drugs, like we don't want you in the community because you're going to be sick more often, most likely. So you need to have that level of personal responsibility to take care of yourself, your body. So the funds of the community are protected, so it's different. And then when you have to go to any doctor, you go in as a cash pay patient, you have the freedom of not having to be stuck to a network. So philosophically for me, it's just such a much better match than health insurance because you are supporting something that is not profiting other people's sickness, but it's the opposite. It's profiting of people's like being healthy.
Right. Like your community is only as healthy as the sickest person. So everybody wants everybody to be as healthy as possible.
Yeah.
And that's the other thing, a lot of people are paying a lot of money premium wise, and then they don't even get to pick who they're going to.
Yes. Yeah.
Or what kind of care they're getting, essentially.
Yeah, exactly. And I was talking, like yesterday, I was actually talking with my business development person, and she's a perfect example of this. She's over 50 woman. She used to have health insurance. She was paying over $900 a month. And then she had to go to the dermatologist because of some like possible little stuff on her skin. Every time she went to the dermatologist, besides paying the $900 a month premium for her health insurance, she had to pay $300 per visit. And then when she switched to our MPB Health sharing programs, she pays now only $460 a month for the membership. And when she goes to dermatologist, her cash pay price, it's only $85. So that's crazy,
what the dermatologist is charging for cash pay. Yeah, that's providers will often bill their insurance company at a really high rate because of the reimbursement. And if you have a deductible, a lot of times you're paying that higher amount than if you opted for like a cash pay rate with somebody. Yeah.
Exactly.
So sometimes I have clients that say they want an MRI or something, but they don't want to go through their insurance. They just go cash pay so that they can get the imaging done, expedite the process a little bit, and they're honestly paying so much less.
Yeah, but isn't that so unfair? Because like you're paying for insurance,
you're paying a premium,
right? And you still have to
I
not use it. I have somebody
that pays $3,000 a month for her premium. And then to go to PT, traditionally they send you, if you have insurance and you go to a traditional model of PT practice, they want to see you 2 to 3 times a week. She's a copay $70 a visit. So that $3,000 isn't even covering anything
which
on the
is
front
crazy.
end.
Yeah.
Yeah. Insane to me.
Yeah, yeah, and that's exactly why we're basically like fighting the system in that sense. Obviously, health sharing models are not for everybody, right? Like I mentioned, you have to be
Right.
relatively healthy, because if you have a lot of chronic type of diseases, there is a phase-in waiting period for pre-existing conditions. But outside of that, it's just you're going to be saving so much more, supporting a community that wants to see everybody healthy, and not supporting like this system that makes no sense.
So, walk me through an example of a woman, she's part of your healthcare community. She gets pregnant. What would that look like from start to finish?
So you cannot come in already pregnant, but if you have the plan and then you become pregnant, depending on the plans, you have to wait depending like 6 months usually, then it's covered. So
because you've paid enough into the health share essentially.
yes. So then we have, instead of having a deductible, we call it IUA, initial unshareable amount, which is like the same thing. But you can choose. So let me give the example of the 1,250. So up until 1,250, once she's pregnant, she has to go to the doctor, do all the pre-examinations. She will spend up to that 1,250. After that, she basically has to make sure that she has all her bills, take a picture of all her bills. She goes into our member portal, submits all those bills. Then it's open at what we call a sharing request instead of a claim. And then during that process, after 1,250 is reached, then the community will share in on the other bills. So basically, you can have a baby and only spend 1,250.
Okay.
Which is crazy because when I had my daughter, it was C-section $30,000,
So when they submit the bill, so when they go to the hospital or wherever they choose to have the baby, they're going to say, I'm not insured under traditional. So they would be charged like a cash pay model by the provider facility.
So for the maternity or any surgeries that you are going to like know in advance, so everything that she did up to that 1,250, she's cash pay patient, right? So she goes in the hospital. She doesn't have to say anything about health share. It's just, I'm a cash pay. That's it.
Okay.
But once she knows, like, okay, I'm going to have my baby maybe whatever, August, the date is, she has to keep in touch with the sharing community because they will be organizing everything in advance as well for that surgery or the birth. Yeah.
Okay. Yeah, I mean, I don't remember I paid a few $1,000s at least out of pocket to have my kids.
Yeah, same.
And I always had them in the beginning of the year. I was pregnant in the last part of the year, so I'd pay the deductible that year, and then I'd pay the deductible the next year.
That's the thing. That's the thing. We don't have that. So if you, like, for example, there's so many different examples that I can give, but I know there's this woman, she had a son, and he had some issues, like from birth. She paid her IUA at the time, I don't know if it was $2,500, and the issue with her son continued for 4 or 5 years. She didn't have to pay that $2,500 every single year anymore.
Gotcha.
Because it would still cover under that same sharing
It's a
needs.
particular like diagnosis or incident or care, because he's going to be under that kind of care for however
a long
many
time.
years.
Yes. So basically, you pay your IUA, initial unshareable amount, and then it covers all the way until it's healed. So that's again another major difference from traditional insurance. You don't have to like scramble by the end of the year to do everything because you're gonna have to pay a deductible again next year. You don't have to worry about that.
Continuity of care, where in the PT world, the beginning of the year, everybody's deductible kicks back in, so everybody disappears. Nobody's coming to their appointments because they don't want to pay their deductibles, and you're like, but you need to be here to get better. So it's like this vicious cycle. So where do you see healthcare evolving in the next 5 to 10 years?
Well, I think AI is going to have a huge impact. It already is, right, with healthcare. I think people are also more aware of themselves, and more than just physical, but the mental aspect of it is pretty big. That's why we include, mental like sessions in our plan as well. But I think prevention is going to be so major because, again, with AI, you can prevent so much more. Like people are getting, those like the multivitamin shots, these different tests that you can do right now for you to see, like, are you deficient in a certain hormone? Are you deficient on a certain vitamin? They're going to be, I think the prevention is just going to become so major in the next years.
Yeah, we have so much access to even really in-depth labs and testing that we can just get ourselves essentially and then do what, and it's coming with, breakdowns by providers. So it's not back in the day where people were like Googling their medical stuff and, as a provider, they come in and they tell you. I think patients always know what's wrong with them. So I'm very huge proponent. People will tell you what's going on with them, but there's real knowledge accessible to people now to help bring back some self-agency within their care. Yeah. I also think a lot of providers are going to be leaving in-network practices and start becoming more cash-based or concierge and stuff, because I think on both sides, the patient, client, and provider side, we're just kind of really fed up with a traditional insurance model.
Yeah, we have a lot of doctors that have our membership because of that.
I don't blame them. So as far as like leadership, you blend together your business strategy and an understanding of human behavior, because you have a big background in human behavior, between like your own understanding of neuroscience and psychology, but even like the acting side of it, I feel like really helps you understand human behavior. So how does that show up in how you run this company?
Well, I think it shows up because people, we're dealing with people, right? It's not just employees. They're people.
Healthcare is, it's more than just business.
They have feelings, and they're not going to be having a great day every single day. There's going to be disagreements, and you have to know how to maneuver it all. So basically, talking with every single employee is going to be different. Not that you need a different personality for each one of them, but you have to express maybe the same message in different ways in order for them to better understand. And, to be sensitive enough that you don't offend people, but at the same time firm enough where they realize, well, this is what we're doing, this is the path. And it takes a lot of psychology for sure, because people, like, we work with all kinds of people too in our business, from different backgrounds, different cultures. And it's basically being able to intuitively feel what that person needs in order to make them more successful. Because if they're successful, the whole company is going to be successful. And I think the great thing that we have at MPB Health is that all of the employees are it's a very good sense of camaraderie, and they want to help one another, and everybody in the company knows what the mission is. They know what the business is as a whole. They don't do just their job and like, oh, okay, let's, for example, I work in marketing, all I do is graphic design and that's it. No, they know the entire business. They know how the health sharing model works. They know the benefits. Like, everybody there knows everything. And I think that's a great benefit. And that's what I try to do in my leadership, is to make sure that they feel super involved. And I take all their ideas into consideration. It doesn't mean that I'm always going to listen to what everybody is saying and making decisions based on that, but it does mean that I take that in consideration. I think it's important because they're dealing with different aspects of the business. Someone in customer service is dealing directly with the customer. I want to know what is going on. Like, are they having issues? What are they happy about? Somebody in IT is doing something completely different, but it's still all connected, and they all know they have a voice. And I think to make people feel that way, it's very important, because they feel like they own that project, that they're part of it, that's bigger than just a job. And I really believe that everybody in the company feels that way. And that's how all those different skills come together.
I mean, that says a lot that you can have people from all different perspectives show up and work together, because it is rare to be in a culture, in a company. And even in healthcare, you think healthcare is going to be that way, but healthcare companies are sometimes very toxic to work for.
Yeah.
And the departments tend to be, even provider to provider, tend to be just, for themselves, because there's so much pressure from the higher ups of like productivity and things like that. It's really turned healthcare into a business rather than what the real purpose is to take care of people.
Yeah. And obviously, again, like any business, there are disagreements. Like, we're not perfect, right? But
that's healthy.
Yeah.
To have disagreements, but also then comes to the other side of it, because you have that foundation of connection and engagement and being on the same page with the same goal. Those disagreements are, going to go to the other side of where you're finding out a really good solution to it.
Yeah, and I think it's also part of being professional. But trust me, I've worked in toxic environments before too, where there was people yelling and screaming, cursing, like it was terrible. And and it's so much easier for like any leader to just curse and yell, because you don't have to actually explain what's going on. There's no intelligence behind that, right? So when I saw that, I made a point, like, I'm never going to be doing that in
so
business.
That's a huge part of emotional regulation. And I know when I came on your podcast, we were talking about the nervous system, nervous system regulation, and you coming in as a regulated leader, you're emotionally regulated, you're flexible because you know all of these different roles, and you're self-aware, but that's trickling down to your employees, essentially.
I think so. Yeah.
But if you were the leader coming in and kind of, dysregulated or yelling or not hearing, then you would see that across the board with the culture of your company as well.
I believe so. Yeah, I've seen that happen in the past.
So that's incredible. It's a big extension of who you are. So
thank you.
How many, as far as like your perspective and being in this business and working now directly with healthcare and the clients and what you're seeing, and as far as trends of how they're getting better or they're staying in the system, how much of the health outcomes do you think are influenced by stress, lifestyle, environment?
Well, honestly, stress is a big deal. I mean, I would say almost 90% is coming from stress, because the stress, it's something that builds up. So, and it will show up differently for everyone. Obviously, I'm not a doctor, right? So I can't really talk about specifics, but from the trend side, it's like you can, today you start having a stressful situation, it starts going on for like 5 years. Yeah, something's going to happen. Like, there's going to be a consequence in your body, in your physical body, whether it is on your stomach or back pain or whatever that might be. And I feel like it's just as important as any physical situation too, like the diet too, because you do see sometimes people who have, like, for example, drank and smoke for most of their lives and they don't have anything. Sometimes you do see that, right? And then you see people that have been vegan or whatever, and they have a lot of health issues, but they were so healthy, leading such a healthy lifestyle. But again, what was the stress correlation to it?
Right. Yeah. You look at different areas of the world who have the people that live the longest, and I think one of the biggest indicators or factors that play into that are stress.
Yeah. Like there's those blue zones in Italy, and they're eating
the
pasta
lifestyle is
every
like
day.
very carefree, and yeah, I mean, they're smoking, they're drinking, they're whatever, in moderation, but the biggest load on our system, I think, is stress. For sure. So, okay, so we're going to start to wrap this up. So we're going to go into what we call the FeelWell standards. This is where we go through a rapid round of questions so you can show us how you live and perform as a standard.
Okay.
So I'm going to shoot these off to you, and you answer with whatever comes first to you. Okay. Control or surrender?
Control.
Structure or flow?
Flow.
Precision or speed?
Speed.
Discipline or intuition?
Intuition.
Lead or delegate?
Lead.
Thank you so much.
Thank you.
All right.
Oh, this
That
was
was
great.
awesome.
Thank you.